In 1976, Peter Piot, a Belgian-British microbiologist and virologist, discovered the Ebola virus while training at the Institute of Tropical Medicine in Antwerp, Belgium. Ebola disease is a rare but severe illness in humans. It is often fatal. The first recorded cases of Ebola disease in human history occurred in 1976 in two simultaneous outbreaks, one in South Sudan and the other in the Democratic Republic of the Congo. Fruit bats of the family Pteropodidae are suspected of being the natural reservoir for the Ebola virus. Fruit bats are essential to forest regeneration. They pollinate hundreds of economically and ecologically important plants and help disperse seed, making them critical for maintaining healthy ecosystems. It is being alleged that bushmeat from fruit bats are strongly linked to Ebola outbreaks. When humans hunt, handle, and butcher these bats for food, it is suspected that the virus is transmitted to humans. The symptoms of Ebola, according to the World Health Organization, are fever, fatigue, muscle pain, and headache. These symptoms are followed by vomiting, diarrhea, abdominal pain, and internal and external bleeding. The Ebola virus can be transmitted from person to person through bodily fluids such as blood, urine, saliva, semen, sweat, feces, vomit, breast milk, and amniotic fluids. The first Ebola vaccine to be created and approved was ERVEBO, also known as RSV Delta GZBOV. Originally developed by the Public Health Agency of Canada, it was later manufactured by Merck and approved for use to prevent the Zaire Ebola virus strain. What are the known side effects of ERVEBO? The known side effects of ERVEBO are headache, fever, fatigue, muscle pain, somnolence, reduced activity, arthralgia, arthritis, joint pain, chills, decreased appetite, injection site pain, abnormal sweating, nausea, vomiting, diarrhea, and mouth ulceration. Dr. William H. Foege pioneered the ring vaccination strategy as a targeted public health approach to contain outbreaks by aggressively vaccinating people in close contact with infected individuals. This creates a protective ring of immunity that prevents the disease from spreading further in the general population. Let's examine the consequences of the ring vaccination strategy using ERVEBO and the known side effects: fever, fatigue, somnolence, diarrhea, and vomiting. Imagine the ring vaccination strategy's impact on a family of 6, which includes a mother, father, and children from the ages of 12 months to 6 years. The father is identified as the index case by public health workers. The entire family is vaccinated according to the ring vaccination strategy. The parents and children begin to experience the known side effects from ERVEBO: somnolence. Somnolence is a medical term known as drowsiness or excessive sleepiness. Fatigue, a state of overwhelming exhaustion, lethargy, or a persistent lack of energy that is not relieved by rest or sleep. Fever, vomiting, and diarrhea. How does a family survive the side effects from ERVEBO? If the parents are incapacitated by the vaccine side effects of ERVEBO, how will the infant and children survive? Who is responsible for cleaning up the vomit and feces? To be clear, Ebola virus is spread through bodily fluids like feces and vomit.